We're so excited to announce our new partnership with Therapy Notes.
Whether you're looking to streamline your private practice or you're a solo clinician juggling it all, Therapy Notes has you covered. Rated 4.9 stars on Trustpilot. It's no wonder they're the most trusted EHR for behavioral health.
Try Therapy Notes for 2 months free using the promo code MODERN today.
You're already listening to our podcast, so let's get you some continuing education.
We provide monthly CE pod courses. We already have 12 and are adding new ones every month.
Check them out at moderntherapistcommunity.com/pod course.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhelm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhelm with Katie Vernoy, and this is the podcast for therapists about the things that we do in our practice, often exploring the things that we don't really talk about a whole lot in our fields. We hear from our listeners quite often, like, you guys are the ones who are having these conversations that nobody else really is. And so we're always glad when we are able to kind of circle around to some conversations that are even new for us to talk about. And we haven't really dived in any sort of depth to countertransference and working with that and even being able to identify that. And helping us with our discussion on this is Dr. Amy Meyers, LCSW. And really glad to have you helping us lead this conversation today.
Well, thanks for having me. I'm thrilled to be here.
The first question we ask everyone who comes on our podcast is, who are you and what are you putting out into the world?
Well, who am I is a very deep question. But who am I for the purposes of this? I am a professor of social work at Malloy University on Long Island. And I am also a psychodynamic psychotherapist with 30 years of practice experience. And I maintain a small private practice in Manhattan. And now I guess I joined the world of podcasters because I'm coming up on my 1-year anniversary of my own podcast that focuses, I'll tell you all about that at the end. It is called What Would Dr. Meyers Do? But it focuses on countertransference. So how fitting is it that I'm here to talk about countertransference?
So one of the things that we ask is kind of a learning process, not to shame anybody, but what do therapists usually get wrong in working with transference and countertransference?
Well, that's a great question. I think it's about not being aware of oneself. And in order to be aware of other people and their transference, you have to be aware of your countertransference. So is it okay if I back that up to what is countertransference? Because
absolutely, yeah.
I think it needs a lot of clarification. I think it can sometimes be overused and sometimes simplified, right? Sometimes people just say how important self-awareness is in this field. But countertransference is much more than being self-reflective and self-aware. It's really understanding oneself on a very, very deep level so that if one understands what is being tapped into emotionally on the therapist side, then we're able to be armed with the ability to distinguish whether or not it's our stuff that's getting in the way from intervening with a client or relating to them, or if it is in fact something that the client is bringing into the relationship and is kind of a representation of what goes on in the outer world for the client. So let me, if I can, give my definition in a way, or a conceptualization of transference and countertransference that in a way that I try and help my students conceptualize. So I say that we move through this world having had a lot of experiences as we were growing up with significant others and people in the broader community in our environment, whether it's schools, with peers, with teachers, with mentors, religious community, whatever it might be. And we take in those experiences and we make them our own. Right? Meaning that if I had an extremely critical mother, I take in that messaging and I believe it. It becomes my self-perception. So that's what I mean by taking it in, internalizing it and making it my own. And then I move through the world externalizing that, right? Projecting that into the world, expecting others to receive me or respond to me in the same way. You know, staying on the student realm, one of the ways that I help my students understand this is to think about students who come into the classroom and are extremely quiet versus those who are extremely vocal. Now, I am an authority figure in a classroom just by the mere nature of probably having more knowledge about what I'm teaching than they are receiving, and also because I'm evaluating, right? So that immediately propels me into a authority role. And so clients, if they had a critical parent or, experienced bullying or whatever it might be that shaped them, may feel that their experiences, voices, opinions, perceptions, views aren't going to be well received. And so they stay quiet, right? Versus the ones who may have had more positive experiences and are free to express themselves. Now, obviously, that's not the only reason why somebody is quiet in the classroom. We don't want a one size fits all, but it's just an example.
So when new clinicians especially are starting to tiptoe into this idea of transference and countertransference, where do they stumble? What are the difficulties that they have in trying to use that within their clinical work?
I'm someone who believes that anybody who's doing this work should probably have been on the other side of the couch and should have had their own experiences in therapy where they can become extremely emotionally attuned to themselves, kind of understand how and why they think the way they do, feel the way they do, act the way they do, and move through this world the way that they do. A lot of folks don't do that internal work. And so when they approach work with clients, they don't have the ability, as I was saying earlier, to distinguish who are the feelings really coming from. And if I don't understand that, then I can't intervene in a way that's beneficial to the client. I might just be responding based on my intuitiveness or instinct or stuff I haven't worked out. So I think that that's a huge challenge one big theme I have amongst beginners, certainly, and a lot of seasoned folks too, is dealing with confrontation, right? People don't like, it's like the ugly C word, the other ugly C word. It's, seen as mean, cruel, hostile, and confrontation doesn't have to be. It's got a lot to do with tone, timing, context, right? But if one's own inner experience is having a lot of difficulty dealing with anger or upset, then somebody's going to avoid those kinds of communications, conversations. And again, if somebody has a client who's upset about something, somebody might just impulsively respond, get defensive, or because of feeling anxious, may apologize. And that doesn't always serve the client. Doesn't mean that a therapist can't be wrong and should apologize at times, but that's the piece, is that the therapist has to understand, am I apologizing because the client deserves my apology and I made a mistake, or because I'm really scared of my client's anger?
I want to go back for a moment on this because, especially talking with early career clinicians on this, some of the, I guess, stories that I hear, and even going back to some of the ways that I was taught about countertransference, is that it's something to be avoided. It's something that is just like, this is bad, don't have it. And so, I feel like, this is probably not for all of our listeners here, but for other people who've just been kind of like, countertransference is this bad thing, don't go there. I feel like there's a step in the middle there that's like, okay, you're talking like, all right, notice this, be able to, see where it's coming from, confront it. But for people who need kind of this corrective, like, no, this is something that happens, here's how to notice it. What is it that you're hoping your students get out of going to therapy, being able to notice what their reactions are to things? As you're working in supervision, how do you point out countertransference as it comes up?
Wow. First of all, I have to say, I have never heard that before. So that was really
I am full of
shocking.
surprises. Yes.
Wow, that it's a bad thing and avoid it. To me, that's like avoiding your humanness. How do you do that?
Oh, that was the whole blank slate thing, right? We were supposed to not actually exist as human beings in the room.
That's not how I understood the blank slate thing. The blank slate thing, according to my understanding, is that if we don't show our emotions, and we've moved a long way from there, at least I have, because I was trained slightly in that way, psychoanalytically, is that if we showed our emotions, then we are getting in the way of the client's potential projections, their own transference.
Sure.
So let me back up a little. Transference, just for those who may be a little confused, transference is the client's projections onto the therapist. Countertransference is the therapist's projections onto the clients. I think it wasn't about not having feelings, because then we'd be dead, right? It was about really managing them. And Curt, when you were, when I was sitting in the midst of my silent shock as you were saying that, my mind was spinning to some other work I do, which is around diversity, equity, and inclusion. And one of the things that I always begin with is, it's not my goal for you not to have biases, because then you wouldn't be human. It's my goal to have you understand and manage your biases and become more knowledgeable about what you're biased about, so that hopefully those biases can shift. And it's kind of the same idea about countertransference, is that if you're just acting without consciousness based on your life experiences and how other people have responded or related to you, and that's how we've developed our worldview, then if we just operate from the hip without understanding what is creating that, then I think that leads to really dysfunctional relationships.
And if the dysfunctional relationship is with your client, it seems like that could be very, very harmful.
I believe so. Or just certainly not helpful. I guess it could be on a spectrum from not helpful to harmful, depending what you're acting out.
Therapy Notes is the highest rated EHR for behavioral health, combining secure billing, scheduling, telehealth, documentation, and even e-prescribe in one easy-to-use software. And they're always adding new features to help therapists provide better care to their patients.
In addition to tutorial videos, live webinars, and articles designed to help you along the way, they also offer free live customer support 7 days a week, with new extended hours to better accommodate West Coast customers. Use promo code MODERN for 2 months free and see what all the hype is about. So how do you think countertransference should be taught? Like, what are the what are the things that we should understand about it? I'm hearing that there's a deep awareness. There's the understanding of what's mine, what's the client's, and moving forward with that. But then what? What do we do with that?
Okay. I mean, to me, it's all about understanding. And sorry, Curt, because I think you were also asking that and I didn't get to that piece. So thank you, Katie, for raising that again, which is, how do you teach it? What do you do with it? So when people are processing their experiences with their client, whether it's in supervision, or maybe sometimes they bring this stuff to therapy because it's touched something upon them, right? But if they bring it to supervision and they're talking about what happened, to me, it's imperative to say, well, how did that impact you? How do you feel about that? And also getting to, how do you feel about your client? Is this a client that you look forward to seeing? If not, why not? If so, why? Because it's really important to be mindful of positive countertransference as well, because sometimes when we feel really aligned or identified with someone or just like them, then we might not push them into the areas they need to go because we want to maintain that likability. Because not usually when we like somebody else, they like us. And it feels good to be liked. And so sometimes we don't want to mess with that. So I think, teaching it sounds pretty simple, but a lot of people don't know how to do it, which is just and it's not about treating the therapist as a client. It's about just, again, treating them as a human being with emotions and acknowledging that they have them. And how can we learn from them? And how can we see how that comes into interaction in their work with the client?
I wonder how much of the, I guess, disparity that it feels like is, just as far as what Katie and my experience has been is, I don't know, the reputation that I've heard of kind of like the way that East Coast therapists tend to be trained is more in the psychoanalytic tradition. Out here on the West Coast, it seems like a lot more push towards CBT, a lot more humanistic kinds of things, which does include a lot more of creating space, at least on the humanistic side, for some of the therapist sort of stuff. But I'm not completely ignoring the psychoanalysts here on the West Coast, but they don't seem to be as prevalent as on the East Coast.
That's really curious. I wonder why. What do you make of that?
I've never been asked why on this question before, but
Curt's been put on the spot.
That's what I do, right? That's what I do. Where does this come from? What makes this happen?
It seems to me, I don't know, from the outside end of things, it seems like there's a lot more on the East Coast side of things that to remain more in the psychoanalytic traditions. Maybe it's just the Wild West out here where there's just kind of a little bit more freedom to pick and choose and do things. But it does seem to me when I talk with a lot more East Coast clinicians that analysis as a part of training seems to be something that is more regularly done, acknowledged. And for us out here, it does seem to lend to some of these things where even the supervisors don't push supervisees into looking at countertransference, that it is something where it's the people who don't know leading the people who don't know. And that's just kind of perpetuating some of the issues that you're talking about.
That's really interesting. But also, if you're not as inclined to be trained in psychoanalysis or psychodynamic psychotherapy, and I think that there's a bit of a difference. And I think that we are moving more to psychodynamic from psychoanalytic, because psychoanalytic once upon a time was considered something that you do several times a week, right? And nobody has the time for that. Certainly on the East Coast, right? We're all running on to the next thing. So I think there has been a movement, and even just evidenced by like when I went for my training, it was 10 years of training. Now you can do these programs in anywhere from 2 to 4. So just that kind of speaks to an understanding that I think all of us are in a very different place in terms of also waiting for results, waiting for outcomes, waiting to feel better, not as being able to tolerate the idea that therapy takes time. So there is also a lot of CBT out here on the East Coast. And I think for things like CBT, you don't probably need to be as self-aware, because you're really offering tools and ways of doing things and trying to shift behaviors with some concrete tools. It's a different way of working. And I'll say that for myself, over many years, I've become more eclectic in my work, because I think that, as I'm saying, people have different abilities to tolerate, not seeing the outcomes immediately, right? We're a society full of impulse control issues and needs for immediate gratification. So you can either get on board, or you can be, working with your 2 clients a week. So instead of a full practice. So, it's what was your question, or was it an observation?
I don't know. It was more of an observation that there's just kind of, in perpetuating maybe some of the problems that when it comes to actually acknowledging countertransference comes in. If you don't have great models in supervisors and colleagues and being able to look at it, then who's really pushing you to do the work? Who's teaching you to go in and do the things that make you uncomfortable, or, not be likable in therapy because you do have that countertransference to be liked by your client?
Well, that makes complete sense, right? If you don't have a model for anything in this life, if you think about it, how do you know, right? How do you know what to do, how to be, how to act, what's appropriate, what's not appropriate? Yeah, right on.
I actually, on the West Coast, kind of grew up psychodynamic. I was trained psychodynamically. And then I worked in community mental health, and it was all behavioral, cognitive behavioral. And so I have, I think, grounding in both. And I feel like when we're talking, you're speaking to this awareness, and my impression, and so correct me if I'm wrong, is that a lot of psychodynamic work is that if you are aware, then change will happen. And I think that the shift with CBT is you make behavior change. And so there are specific behavioral changes that happen. And so I think that, Curt and I shifting more into that behavioral thing is like, okay, well, what do I do with that awareness? What are the interventions that I have for myself when I am aware that I have this type of countertransference? And so that may not be the best question, I don't know that we're going to get where we need to go with that question, but I think there's that element of there's so much that I think we can be aware of. There's so much nuance, especially if you're looking at what's the client's and what's mine. And then there's also what's ours together, especially when there's so many differences and so much lived experience and expectation based on who we are and how we show up in the room, that it feels like it gets very complicated very quickly. And so I don't know if maybe a case example would be helpful or some way to really talk through, how do I use this information effectively to be able to then work with my clients more effectively?
First of all, that's a great question. And it reminds me of my own therapy, right, that I was in for numerous years, where I would often say, I'm aware. Now what? Right?
Exactly, right?
Absolutely. And so I certainly understand that question and that feeling. And I think that the reality is that awareness does not lead to change. What awareness leads to is an ability to consider how you feel, how you move through this world, and that there's potential to shift what you know and what is familiar. And we tend to stay what is familiar because it's comfortable.
Yeah.
And so being pushed to consider options of either in your interpersonal issues, let's not say either, let's just focus on interpersonal issues because that seems to be what, I don't know, I'll just throw out some random number, 90% of the population is struggling with, right? So if you understand that you can move, think differently, feel differently, shift how you are receiving these messages based on countertransference. But so, okay, yes, I understand that I had a very critical mother, but that doesn't mean that that's how person A, B, and C is thinking about you as well and will receive you, right? So I think that a lot of the progress in therapy is from the relationship between the client and the therapist. And it's kind of like a corrective emotional experience and being reparented, because how the therapist responds to you, hopefully, is in a very different way than you've experienced, right, in your early life. And that is transformative, I think. So an example, I'm happy to give an example, but I have several examples and I'm not sure which is the most helpful or, if one really understands this stuff by really expounding on one deeply as opposed to a couple, but I'm going to try and see what happens and you can steer me where you like. So one example, I had a client recently who very close to my age, a little bit older, who has an elderly mother, a little bit older than my surviving father. Her mother lived with her, is living with her, and she was finding it extremely difficult to deal with her mother's dementia, which was mild, because I think that's an extremely difficult thing is when a parent is in this new phase of functioning and there is so much unresolved work with that parent that it's hard sometimes to see the dementia as dementia and not just as this critical parent or this annoying parent or, doing and saying things that are completely inappropriate that has to do with the dementia as opposed to, the person in whom they were and how they related to you growing up. Here's the thing is I completely identify with that because my mother passed away a couple of years ago from dementia, and I did have a conflictual relationship with her, if you haven't been able to tell that. An example that I keep rebounding to, which is the critical parent. And before I was aware of the diagnosis, right, there's this period in between where the behavior changes, but you can't quite place it and don't really know what's happening. So I was very angry and upset and would let her know that. Whereas I felt like later on, if I had an understanding of what was happening, I probably would have been a hell of a lot kinder to her. So what I was saying with my client was identifying with her frustration, right? That's not the countertransference. But the countertransference is seeing her response to her mother and getting really bothered by it. Because it was tapping into how my mother would relate to me and understanding that, and also what was going on in the here and now, right, with my own mother, and feeling like, where is her empathy? And why can't she just tolerate and stop and intellectually understand what was happening with her mother? But she couldn't because the emotional piece was too large. And countertransferentially, I was struggling with the exact same thing. So how did I have this expectation of her when I couldn't even live that myself. So that's one example. If I wasn't aware of what was happening, I would keep directing her to like, be kinder to her mother, or be more, is there any way that you can be more empathic towards her? Is there any way that you can communicate your needs to her, blah, 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 right? But no, her mother was limited. She couldn't do it. But when you're going through the same thing at the same time, it's very, as you said before, messy or clouded, right? So my knowing that, again, what does awareness get you? My understanding intellectually that I was struggling with the exact same thing that she was, did that help me? Yes, it did. Very much so, because then I could process it outside of the therapy session, and that would arm me with the ability to go back the next time to be more understanding and patient and separate my experience from hers.
How did you come to that realization? Like, can you walk through kind of what your expertise work in your own countertransference looks like in order to be able to identify that?
That's a great question. And I honestly, my gut reaction is no, I can't. And because it has become just such a part of me. And I think with anything, it's like the more you practice something, it just made me think of a religion, even though I'm so not religious, right? But it's self-awareness, this understanding on this level is like a religion. The more you practice it, the easier it gets, the less it becomes like a lesson, and it just becomes a part of your system and way of functioning. I mean, it is such a part of me that I do this in my friendships, in my relationship. It's sometimes a little overdone, but I think for the most part, it helps me to have healthier communications and more satisfying relationships.
I guess my question is, what's this? Is it just kind of paying attention? Is it asking yourself questions? Like what is it that you're doing it sounds like in all of your relationships to stay aware of your piece of it?
It's almost like I'm kind of inside myself and outside of myself at the same time. Do you ever have a conversation where as you're having it, you're kind of saying, why did I say this? Should I be saying this? Is this the best route to be going? And if not, while it's happening, immediately after. I think we all, not we all, certainly don't all. A lot of us do that, but we do it in a very judgmental, self-critical way. And so I think that having done this as a process of therapy and a process of supervision and a process of training, it's been done with a kinder voice. So it just becomes kind of a reflexive process. It's like a muscle that you're working, I think. Curt, like you said earlier, you've never thought about this. You've never been asked this, or I've never been asked that question before. That was a great question and will certainly resonate after we are done with this episode. But I hope that helps a little bit in my trying to claim that.
Breaking in here real quick to tell you how much fun it is to put out longer form episodes and provide some CEs. I'm having fun. Are you, Katie?
Mostly. We've got some great stuff lined up for this year, and we've already got some amazing courses.
Suicide, parental alienation, dual relationships, law and ethics.
And some lighter stuff like walk and talk therapy, elite athletes, celebrities, executives, and goal setting.
All you need to do is hop over to moderntherapistcommunity.com/pod course, where once you listen to the episode, you just have to fill out a quiz and an evaluation to get credit.
Can I give one more example? Because I'm living this very moment. And so maybe you can help me, right? So maybe there's more to this than meets the eye, which again, like I'm aware that I'm feeling these things, but have I processed it? No, I haven't talked about it with anybody yet. So this week, we all know what's going on in Israel. I am Jewish. So that is my identity culturally. As I just said, I'm not religious at all. So I had a client and a few clients this week who spent pretty much the entire session talking about the horror and the devastation and their own identity and how this is impacting them. So it's very heavy right now. I am holding them emotionally, and I am trying to manage the same feelings that are coming up in me that I've already been aware of before these sessions, but that is being deeply tapped into while they are speaking. So with one of my clients just this morning, she had recently broken up with a boyfriend and she's really kind of experiencing that sense of loss. And she alluded to that. So, here's where I am this week. I was doing really well and now I'm struggling with that, but then kind of launches into this whole thing about Israel. And I'm hearing that the theme is loss, right? And then I'm hearing that she feels attacked at work by a supervisor. She had her evaluation and the way that the feedback was delivered. So what do we have here? We have themes of loss and attack, right? So these everyday life things, right, are coming into this much bigger picture of what she's presenting. And I'm feeling an immense sense of loss. And I'm thinking, as this is happening, what is going on with me? Right? I do not have any loss right now in my life, but abstractly, the loss I'm experiencing is, I think, vicariously through other people, as well as feeling like I'm being attacked. So the loss and attack that I'm identifying with her, I'm experiencing. The attack is in that this is she's feeling attacked, by her boss, for example, right? In the way that her feedback was delivered. And it's feeling very personalized. And that's what this Israel issue is feeling like, right? It's not feeling like it is an attack. So what is it tapping into me? One is the identification with profound sadness with the state of affairs, right? And the shared cultural identity. But the countertransference and identification and projection are parts of countertransference. But the part of the countertransference that is tapping into my stuff is this sense of aloneness. And there's the loss, the sense of aloneness in people not really understanding the magnitude of one's, or in this case, my experience, right? So, and this for me personally is a persistent challenge I have in people not knowing how to listen. So here I am as a therapist. I think I'm pretty good at it. I think that this is what draws people to me outside of my profession, my ability to listen, my ability to empathize, my ability not to, jump in with how I'm feeling, right? Or my own personal example or silver lining the situation, but being really attuned. And I don't think I've ever been aware until the last several years that it sure as hell would be nice sometimes to get that back. And I'm now coming to the point that if I have friendships where it's not reciprocal, not all the time, certainly, it doesn't have to be, 50-50. But if it is not generally reciprocal, I'm not sure I'm interested anymore. So the countertransference here has been in this sense of loss experienced by the client, tapped into in me, which is represented not parallel-wise by me losing through death, right? Or loss of a relationship physically, but emotionally loss and aloneness in that way. And the upset, right, that she's feeling about the horror of what's going on in Israel is being translated in me as I'm listening equally to the horror, trust me, but also with upset or anger at those friends who haven't reached out. So that was a very kind of long-winded, perhaps, or deep analysis of what might be going on for me. And to tell you, how do I know that? Or, how, all I can say is I'm telling you just what I'm feeling. That's really all I can say. And the processing of that needs to happen. I think I need to do more work around that by speaking to a colleague, right? Like a peer supervision group that I have, and putting that out there, so that I can look for other aspects of what I might be feeling and how that might play into how I respond or don't respond or potentially avoid things that the client needs to look at or process or have space for.
It seems like to me that there's so much that has, there's so many elements of what you have been experiencing in this moment of time, and then also the parallel experiences of your client. And as you were talking, I was hearing the attempt to not over identify or to engulf kind of your client's experience into your own experience of what's happening in the world at large, but also recognizing that some of the topics that she's touching on are resonating for things that are related but unrelated. And so being able to really explore what are my emotional needs right now and how do I take care of those so that I can be fully present for this client that is in this same global crisis, global horror, however we want to describe it, but also has these other unrelated but related in a way situations that it's bringing up for her. I feel like when you were talking, it was like there's so much that's kind of attached to your experience that it being able to sort that out, to be able to really understand your client's experience and all the things that are attached to her experience, it becomes much harder when your emotions are so big and so huge. And so to be able to explore it and say, okay, I need to get my needs met here, or I need to do this outside of therapy is really powerful. We're running low on time, but this is a really interesting conversation to me. So I have another question. It's something where as a human and in that moment with whether there's shared identity, shared grief, shared trauma, is there a way to recognize and tease out countertransference in a way that you can use it as a connection here? Because it also feels like there could be a sense of shared experience that could be helpful in the therapy room, but if you can kind of tease it away from the things that would not be helpful to the client.
You hit it right on the head, is that only if you can tease it away, right? And so one of the things that I always say is that if you use your countertransference, and by use it, I think that it's important to distinguish between self-disclosure and use of self, right? Use of self is being aware of what's happening in you, and how can you use that to direct what the client, direct an intervention or an approach to what the client needs. Self-disclosure is exactly how it sounds, right? Is that I'm going to share something of myself with the client in hoping that she will feel a sense of connection or feeling understood. But I just want to make it very clear that I think that there are lots and lots of ways of conveying empathy and that one understands without having to self-disclose. So I'm not big on self-disclosure, perhaps because I was trained psychoanalytically. And so, as you said, the blank slate, right? And I think I've come a long way from kind of positioning myself with that blank slate to just being more of who I am, and sometimes using humor and just letting my personality show a little bit. And still clients feel like I really don't know anything about you. And I think, but you know the way that I relate, you know how I'm going to respond, right? You don't necessarily know the intimate details of things. But going back to your question,
how you can use that shared experience without it being overshadowed by countertransference, I guess.
Right. So interestingly enough, this very morning, I did struggle in my head with, should I share? Should I share? Should I share? And I did self-disclose the magnitude of what I was feeling in an effort to help her create space that she needs to share her feelings and her need for understanding with her friends, because she is the caregiver. And so I, related that, I actually, this is something that I strive to work on too, and doesn't go away overnight. And it's about making room for yourself. And the idea that people actually want to hear you, and consider that you might actually depriving somebody who is a true friend from being able to help you in the way that you help them. And that it would actually be a gift to somebody who wants to help you in that way. And for the friend that doesn't, well, maybe it's a consideration of, do you want to continue to be friends with that person? So I really pulled directly on my very recent experience of this and gave it to the client. And she actually thanked me. And for me, that was probably transformative for me in a way that, again, I have not processed yet, is to be able to share myself with a client, have it well received, and even find it helpful. And there yet again is another parallel process to my own life, right? With hoping and wanting others to receive me in that way. So that's why I always say, if we think we go into this profession to heal others, we are mistaken. We do go in to heal others, but we are 50% of the equation. And I think that's the luxury of this work, is that I get to grow professionally and personally as I'm helping others to, feel more satisfied with their lives. So yeah, thanks for asking that question. That was a good one.
So To kind of wrap up here, what would you recommend for people to continue to do to further develop their own countertransference work?
Okay, go to therapy. If I haven't said that already, right, or insinuated that, go to supervision, right, because there is a distinction, and be open to sharing your work, because I think it's also very scary to share our work because it makes us feel vulnerable and we're showing sides of ourselves and our professional self. And we're open to critique. But this is a field where you kind of can't separate being assessed by. I always try and kind of make the analogy to the business world, where your boss is your boss. They tell you that you're doing well or that you're not doing well, what needs to be improved. And when we go to supervision in this field, we are going to someone hopefully with more expertise, or really just another lens. And even though we might be being evaluated, we can't really grow unless we expose ourselves in a way that allows us to understand who we are as we're doing this work. Yeah, it's hard work. Doing this work is hard work. It's hard work because of the emotional drain, because of the processing that I'm doing in my own head, as much as I'm being there for the client. So I'm holding their stuff, I'm holding my stuff. I need somewhere to put that. So that's another reason why going to therapy and supervision is really, really important. And I also think that reading is really, really important. When you read other case scenarios and examples and people who are talking about doing this work in this way, you're going to build your insight. And that's what it's about. That's what I think it's about, at least if you are working in this way. These are the things you don't need to do if you're doing CBT or working with dialectical behavioral therapy and other ways. And, if that works for you, then that's fantastic. And if it's an evidence-based practice that shows to be successful, then why not? This is a specific way of working.
Where can people find out more about you and your work and your podcast?
Well, thank you. So I have a website. It's amymyersphd.org. I have information about myself. I have a blog, and my podcast is also can be found there. But my podcast, What Would Dr. Meyers Do, is available on most streaming sources. And what we do is I speak with other therapists, beginners and seasoned, and we talk about different aspects of the work, and we talk about their countertransference. And I think that even though it is situated to help people become more aware and more reflective in their work, the topics that we cover are really applicable to anybody as we move through, this life and try and grapple with our own reality. And I think that I think and I hope that it provides a pathway towards greater self-discovery and insight.
Thank you so much for joining us and sharing in our disbelief in the way that countertransference differs from one place to another. But we will share links to your stuff in our show notes. You can find those over at mtsgpodcast.com. And follow us on our social media. Join our Facebook group, the Modern Therapist Group, to continue on this discussion. And until next time, I'm Curt Widhelm with Katie Vernoy and Dr. Amy Meyers.
Don't forget to check out Therapy Notes, the best practice management solution for behavioral health.
And use promo code MODERN for 2 months free. Care more and worry less with Therapy Notes. Don't forget, we've got some fun, interesting, and important CE pod courses over at moderntherapistcommunity.com/pod course.
Head on over and check them out.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.